Hi everyone, welcome back to MedGoto. In the previous video, we spoke about alveolar gas equation, we spoke about AA gradients. So in this video, I just want to go through a case of how we can apply the alveolar gas equation to a clinical scenario that is being presented to us. So let's go through this question together. And basically here, I want us to be able to figure out if this patient has problem with gas exchange or not. So it's a case of 56-year-old male patient that smokes 1 pack of cigarettes a day for the last 35 years. So the patient presents with shortness of breath plus cough that has been getting worse for the past 3 months. So when the patient presented, patient has low oxygen saturation. So we decided to do arterial blood gas, ABG. And the ABG showed pH of 7.32. The PaO2, the partial pressure of oxygen, is 60. And the PaCO2, the partial pressure of carbon dioxide, is 55. So, so the question here is that, does this patient has problem? Is there a gas exchange defect, right? So that's the question I want to figure out. So does this patient has gas exchange defects? And the one to answer this question for us is going to be our AA gradient. So obviously, looking at this, we can definitely say that this patient does have some degree of hypoxemia, right? And then we said that whenever the patient has hypoxemia, it's when we see hypoxemia, the next thing we want to ask is, what is the AA gradient? So from this question, we know what our small a is, the PaO2, and then this question is they've given us as 60, but we need to figure out what the capital A is, right? And which is, and how we're going to figure out our capital A. So if you guys said alveolar gas equation, you guys are correct, right? So an alveolar gas, from alveolar gas equation, the partial pressure of oxygen in the alveolar equals to the P atmosphere minus the water vapor pressure in brackets FiO2, right, minus PaCO2 divided by the respiratory quotient. Right? So from here we can see our atmospheric pressure is 760 minus water, which is 47, in bracket FiO2, which is usually 21/100. Then our PaCO2 here is 55, right? And the respiratory quotient is usually 0.8. So if we multiply this out, right? So if we multiply the subtract 47 plus 760, I think that will give us 713, and then multiply by 21 divided by 100, approximately that will give us like 150, right? And so let's divide 55 divided by 0.8. So 55 divided by 0.8, so that gives us roughly 69, right? And then if we take 150 minus 69, so that gives us 81. So that means our P capital AO2 is 81, right? And we already know here our PO2 here is 16. So let's now figure out if this patient has, so what to be our A gradient here. So the A gradient is going to be 81 minus 16, right? And if you subtract 81 from 16, right, down to give us 21. So that means this patient A gradient is 21, right? So, and based on this patient's age, what's supposed to be this patient's normal A gradient? So, like we mentioned, is 4 plus age divided by 4, right? And then this patient's age is 56 divided by 4, right? So that's 14 plus 4, that's 18, right? So this patient normal A gradient is supposed to be 80, right? But his gradient is like 21, so maybe probably a little bit elevated. So we can say this patient probably have gas exchange defects. So I hope this kind of like help us to be able to appreciate how we can apply A gradient to figure out the cause of our patient hypoxemia. Thank you guys for watching, and don't forget to subscribe to this channel.